Hi, I'm Nicole Durr. I'm the dental assistant instructor here at Davis Technical College, and today we're going to be going over the oral surgery pass-offs. Alright, so we're going to go over a wide variety of instruments and items that you'll be using for a surgical procedure. First of all, we'll start with your surgical scrub brush. It's a little sponge nail cleaner. So you have your little sponge, and these are actually very fine little bristles. They're very soft. That's just something that you'll use to aid in doing a surgical scrub. Now, a surgical scrub is 14 minutes long, so you have a 7-minute pre-wash, basically, that you're going to be washing all the way up to your elbows. And when we're done with that, we're going to rinse our hands, and we want to rinse to where the water is running down your arm away from your fingertips, because we want to keep the fingertips the cleanest out of this whole area. And then we're going to wash another 7 minutes, scrubbing all over hands, arms, to do a proper surgical scrub. So we have a 14-minute hand wash, and it's very important to make sure that we do that properly so we don't introduce the patient to any possible infections. Another possible thing that you might have are your surgical gloves. Now it'd have an outer package, and they can come in different size ranges. This one has just an L for large. But the kind that we had, they would have whole and half sizes, like shoe sizes. So it was nice to get a good fit on your glove. These are a little baggy on me, and so I could get a different size that would fit a little better. Once you open the package, this one's our little sample one, so it's missing the other glove. But it will say, and this one, it just has the little hand on it. Sometimes it will say whether it's right or left, but you open it up and it will show one's for the right hand, one's for the left hand. These are sterile gloves. The gloves that we have just in a box, they are considered non-sterile because they're not individually packaged. So if we're doing something that is considered a surgical procedure and we need to keep everything as sterile as possible, we need to have an individually packaged gloves. And as we open it, we need to be careful. We want to make sure that we have put all of our PPE on, and this is the same for just any procedure, where you'll want to get your mask, glasses, your lab coat. If you're doing a lab coat in a surgical setting, they have like the little surgical gowns that you can put on. There's the kind that you wash, or there's the kind that are disposable. And the point is that we're making sure that everything is completely covered. My office, we would work and do sedations. We do sedations in an office with a nurse anesthesiologist, and we also would do sedations at a clinic, a surgical clinic. So we would go to the Ogden Surgical Center, and we would wear regular clothes into the surgical center, and then we would change into scrubs that they had for us. And so we'd grab our size, get changed, and we'd go into the OR room, and everything has the hospital look to it, but we're doing the same dentistry. The patient is just asleep. So we have a few differences where we will do our surgical gloves, and those tend to have a longer cuff to them, much longer than this. It goes probably about this way up, this far up your arm. So if you have a lab coat on, that is going to go over your arm, your jacket, and make sure that everything is completely covered. So we want to make sure that we have the mask, glasses, lab coat, surgical gown, whatever you're wearing, and then we want to wash our hands and make sure that we don't touch anything when we get ready to put our gloves on. Now this glove, it has, and these will be different colors too. The ones that we had were more like a skin color tone, The interesting thing with these is the cuff is folded up. So you don't want to touch any of this outside part. You want to only touch this. And so when you open it, you'll slip your hand through here and make sure that you gently pull that over your hand and up your arm so we don't get any of this. We want to keep that as clean as possible. And then again, once your gloves are on, you don't want to touch anything unless it's pertaining to your patient's tray. Now, all of these instruments that I have them out of the package. It would come in a sterilization pouch like these, but just so we're not listening to us opening up a ton of bags, I opted to have most of them open. But when you have it in a pouch, you want to make sure that it's been sterilized, that you're doing your biological monitoring to make sure that your machines are keeping everything sterile. They need to be in the package until the moment you're ready to use them to be sure that they are sterile by the time we're ready to use it for the patient. You don't want to have your instruments sitting out open like this because you risk a possibility for contamination. So when you're opening your package, you're just going to take this and peel it down and get your instruments out. I'm going to leave this one. We'll talk about that one in just a minute though. And then you'll get ready to do whatever procedure it was that you're doing. Now this is a good majority of the instruments that you possibly will use. By no means will you have all of these instruments for a certain procedure. I worked in pediatrics, and so we were very basic. We would just use a curette, which would do a few different jobs. We'd use it to loosen the tooth and clean out the socket, and then we'd use a certain forceps, and that's really all what we used. But when you're working with an adult patient, you have a little more on the instrument assortment that you might be using. So we're going to go through some of those. So we have our mouth prop right here. So this is best used if you don't have a patient that's sedated. This is something that you can just place in their mouth, and that's just going to help them keep their mouth open so their mouth doesn't get tired through the procedure. Because if you have a patient needing to hold their mouth open for an hour, hour and a half, 2 hours, that's a long time to have that mouth open. So we want to do a nice mouth prop for them. The next thing would be this one. It says a mouth gag, which that's a horrible name. So I've also heard it called a molt. It has these little plastic ends to it. Those will get blood and saliva stuck up in them. So when you're getting ready to clean these, you want to push those little cushions off, run everything, scrub it, run it through the ultrasonic, and then you'll want to go through and sterilize everything after that. So this you could put in the autoclave. I think, and I'll have to double check, but I think it's actually better if this just goes in the cold sterile, because sometimes this plastic gets kind of discolored if it goes through heat sterilization. But this works really well if you have a patient that's either spitting this out or if they're sedated. Your molt is going to kind of click. You have these little notches right here, and that's going to click their mouth open a certain distance. When a patient is sedated, their mouth just locks shut, and it's hard to, their mouth, you'd think that it'd be kind of like if someone is napping, their mouth just kind of easily falls open and it's not a problem to move their mouth. But when they're sedated, their mouth is just tight. And so the dentist will kind of get these two little prong parts in the front part of their mouth, and then he'll kind of twist it to open and crank it to open their mouth. So we'll get a molt out in a minute and we'll show you how that's going to look. Our next item that you would have would be your surgical scalpel. So we have one that you can autoclave, and there's also a disposable. So we have This one is a disposable scalpel blade. The scalpel blade comes in two different kinds of blades. You have a number 12 blade, and then you have a number 15 blade. Your 12 is a little scarier looking, where it kind of has a little more of a daggery point to it, and then your 15 kind of reminds me of like a paring knife. And that would just be up to the dentist on which kind he would like loaded if you have the autoclavable surgical scalpel holder. Okay, so we have this, and then we would use our blade here. So I have a number 12 surgical blade, and then I also have, this one has a 15 in it. So when you open this package has already been opened just for practice sake, but you want to peel it open just to where you get to where you can see this little opening right here. And that's how long the opening is. When we're loading this has a certain slant to it, and it's important to make sure that that slant is compatible with the slant on the holder part for your so it says the scalpel handle. That's what it's wanting us to call it. So your scalpel handle. It's going to, I had to flip this so it was compatible, because right there it's not compatible, so I need to flip it this way to have that line up. So when we're going on to load it, there's little grooves right on the side of this, and I'm going to line those grooves up with this opening. And we're just going to make sure that you have this pointing away from everyone, your patient, your dentist, you. So we're going to slide that up, and then once it's up a little bit, then I move to the side of it, and then I slide it down, and that will snap in place. And you want to keep this covered until the dentist is ready for it. When the dentist is ready, you're going to take this off. And so here we have our 15 blade on there. And when we're finished, to take it off, we can grab some hemostats. And there's a little part of your blade that kind of comes out a little bit. We're going to hook onto that. And I'm going to lift this away from that ridge. If I can get a little better hold of it. And then I'm going to slide, I'm going to scoot a little bit this way. I'm going to slide this forward so it can come off. This would go in the sharps container. Make sure to keep track of your sharp items, okay? You don't want to have your suture needles and your scalpel blades sitting out where they could cut you or anyone else. So take special care when you're working with those. And I'm actually going to move these off just so we don't bump them while we're doing the rest of our instruments. All right, so our next thing, you might have a scalpel blade remover, and so that can help you take that off instead of just using the hemostats that I had. But if you don't have one of these, hemostats will work in a pinch. Tissue scissors. So these are just going to have kind of a longer blade to them, and they're fairly thin. So it, thinking of like your crown and bridge scissors, those have a thicker cutting part to them, but these ones are pretty slender on your scissors. We have some tissue forceps, so these will just help if you've cut any tissue away. You can have those forceps to remove the tissue from the oral cavity. Hemostats, those can come either straight or curved. So the ones that I had before, these ones have a curve to them. So it just depends on what your needs are. And the hemostats, the ends can be long or short. So there's varying types of hemostats, but they do have a little locking mechanism that will hold your suture or whatever it is that you're moving in and out of the mouth. You can use it for tissue or bone fragment. It's kind of like your cotton forceps. It's a universal thing that whatever you need it for, you can grab them and they can help you out. So we have the periosteal elevator. Okay, there we go. So this has kind of a circular end, and then it also has a pointed end. So we have that pointed end right there, the circular side. This is any elevator that we look at. Elevators are to loosen the tooth from the socket. So we're going to loosen the tooth with elevators, and then the dentist will use forceps to actually pull the tooth. Next thing that we have is the surgical curette. This looks like a larger spoon excavator. So it's going to have the same look as a spoon excavator, but like I say, just a larger end to it. This is used to scrape out any, if there's abscess, or maybe the dentist finds a root tip, he might bump into that with this. He's just going to use this to clean out the socket. If there is a root tip, I'll show you what we'll get those root tips out with in just a minute. Tongue-in-cheek retractor. This is kind of like what the name says, keeps the tongue-in-cheek out of the way so we can see what we're doing with our patient. Next thing is your surgical needle holder. So this is just to hold your suture, and as you can see, it has two different styles that it comes in, kind of a hemostat type of holder, or this kind of reminds me of like the little scissors that we use to cut our bleach trays. They both have a little end to it where it has little grooves, and this is to hold on to the needle for your suture. Your suture needle, they have dissolvable and non-dissolvable suture. It depends on what the dentist likes to use in his office, and it also depends on what the patient had done. If it's something that's just a very simple extraction, he might just put a dissolvable kind of suture in there and send them on their way. But if it's something that he really needs to make sure that they come back for their post-op appointment so he can ensure that he's the one to take the stitches out, that he can see if it's healing properly, then he'll go with one that doesn't dissolve, and those are more like a silk-based, silk and nylon and polyester-based suture thread. Your suture scissors, the nice thing with those is they have a little notch on them, like this one. So that is going to help hold the suture thread so it doesn't run away from you. As you're going on to clip it, if you have regular scissors, they'll just slide down the blade of the scissors and it won't stay in place. If you have your little suture scissors, that little notch helps keep it in place so we can snip that suture thread. Now if you don't have these, that's fine. If you have any sterilized scissors, they'll work if you don't have these. So we have our straight elevator. I like to compare that one with your luxating elevator because they look very, very similar. They basically have the same shape. Your luxating elevator is just a little bit thinner on the very working end. So that one, would you mind holding both of those up, please? So there we have our straight and our luxating elevator. And as I was saying, your luxating elevator is just a little bit thinner. Perfect, thank you. So those, as I said before, your elevators are to loosen the tooth from the socket. Here we have a periotome, which is also going to help with implant placement. Root elevators, would you mind holding those up, please? So this, we have two of them, and this also goes by the name of crier, which I don't really think you'll want to say that in an office. So I would just recommend calling them your root elevators, or they've been called east and west. I know some will call it that. Kind of reminds me of like a little flag end to it. So the dentist will use that to, as it says, root elevator, so it's just going to loosen down by the roots. And there's one for each side. It's kind of a directional instrument. Right and left pairs. We have a T-bar elevator. Ooh, I don't think I pulled that one out though. Okay, so we'll just look at the picture on this one. So with this one, it has a little bit of a curve to it. T-bar elevator is named because the instrument comes in this T, but the one that we have, it has a handle like this. So focus on the shape of it, where it kind of looks like a composite instrument like the paddle end, but it curves a little bit. Okay, so you're just going to look for that curve on the instrument. Root tip elevator. Now you have root tip elevators and you have root tip picks. So we want to make sure that we don't get those mixed up. Your root tip elevator, this has little notches, little grooves to help get those roots lifted, loosened from the area. So your root tip pick is going to have the little pointy end right here. Yeah, go ahead and hold that. Thank you. So that it comes to fairly sharp end, and that is for if we have a root that breaks off, the dentist can use the root tip pick to get down in the socket and lift any of those pieces that broke. And it may not have broken from the dentist, it could just be from the decay. Some teeth can be so badly decayed that there's just pieces that you're retrieving from the socket, and so you might be using your root tip picks. Okay, so your rongeurs, these are to clip the bone. Thank you. So these ones are to clip the bone, just to prepare it for if you're doing a denture. They'll call it an alveoloplasty. So that's our rongeurs, clipping the bone. Your bone file. So after you've clipped the bone, we want to make sure that it's smooth. So we're going to grab a bone file. And so this has two sides. So we have one side that has just straight lines through it, and then the other side, this one actually has the same the same on both. But you could also potentially have a little checkered shape to it. But we have a larger and smaller end on your bone file. So there's actually a picture on here that is showing the site already, and they're using that bone file to smooth things out, smoothing out that alveolar bone. Your surgical chisel. Now your chisel would be used if the dentist feels like there's a tooth that if he were to just try to wiggle and pull it out, that it could break at the roots, and we don't want to go digging for roots. That's never fun. So what he'll do is he has a couple options. He can break the tooth with a mallet and chisel. So we have our mallet, thank you, got our chisel. So with this, he'll take that over the tooth, tap the mallet on there, and that will break the tooth into sections. That enables the dentist to reduce on the amount of damage that could be done in the area of the tooth, because if you're trying to wiggle a tooth, you need to get a good motion going, and if that's really big and you have some crazy roots going everywhere, if we separate that tooth into pieces, then there's a smaller amount that he needs to wiggle, and so we're going to help keep the area a little nicer and less risk for breaking a root. Another option especially in pediatrics where you have a smaller tooth to deal with, the dentist may just use a burr and just cut the cut the tooth in half with a burr, and you'll just wiggle each section out. Now he'll still want to check for root tips. He can look at the tooth and see if the whole thing looks like it's intact. If he suspects anything, then he'll get those root tip picks out to get any of those remaining pieces. All right, so there's our mallet. Okay, so now we have the forceps. So we're going to get our 10S, and with your instruments, it can have the instrument number right on the inside of your instrument. Can you point it kind of right through where it'd be? Right about there, okay. It's really hard to see. You have to bring it up. When you're looking, just take a close look when you're grabbing your instruments. You'll get to where you know them by their shape too, but it'll either be on the inside or sometimes it'll be on the outside. So just look somewhere on the end of the handle and you should find the number. Now with this one is for maxillary molars. Something that can let you know on the shape that this is for a maxillary is how it has this extra curve to it. Something that's for a lower tooth, let's see, yeah, that's a good one. It's going to have more just kind of an L shape, whereas this one has that extra little bend right here, right through here. So that one is our 10S for the maxillary molars. The next one would be your number 16 for the first and second molars, okay, for the mandible. This one, sometimes they'll call it the cow horn. And this is one where it's really nice to have an actual one in front of you because you can see just how curved they are. It doesn't show that very well, I don't think, in the picture. So these ones, they'll call them the cow horns, and then we also have these little guys that are the baby cow horns. This one says a 23S on the number with these ones. So this is just used for pediatrics. Pediatrics, you're just going to have shorter, smaller instruments that you're working with. Okay, so next we have our mandibular forceps number 17. And that one, I don't think we had that one. This was like the closest that I could come up with on that one. It's going to have just that very L-shaped look to it. This one has a little bit of a point, kind of at the beak of the forceps. And so this one is going to be for your first and second molars. Next thing that we have is the 88R and the 88L. So these two, oh sorry, yeah, those two right there. So these ones are right and left specific. So you'll notice that we have 2 prongs on this side and 2 on this side. So when we're using them, it's for, and it'll say on here which one's for the right side and which one's for the left side. This is for a trifurcated molar. So trifurcated meaning that it has 3 roots. So these are going to wrap around all of those root areas and help get that tooth out. Okay, so for the first and second molars. Okay, now we have a Cryer 150, or they'll call it the this is the maxillary universal forceps. So your Cryer 150. And so the dentist will mostly just say, I need the 150, okay? Because again, we don't want to hear Cryer. No patient wants to hear the dentist say, bring out the Cryer, because they probably won't stay in your chair very long. So this is going to be used for everything but the molars, because this says for centrals, laterals, cuspids, premolars, and roots. So everything but the molars is for your 150. And then the next one is going to be the mandibular forceps. Universal Forceps Cryer 151, again for everything but the molars, and this is just for the mandible. Now, one thing that you'll notice on some of these instruments, as you're holding it, you see this one has a curve to it. So if you're looking at it and you're going, oh man, what way does this go? You want to lay it down to where the working end is going down, and whether the handle, I'm getting that mixed up on how I'm saying it. Basically, as you're holding it, the dentist will hold it to where the handle is curved up in his hand, and if it's pointing down, that's for a lower one. If it's pointing up, it's for an upper. Okay. All right, so we have our mandibular anterior forceps. These ones are the easiest ones to pick out from the group because it kind of has like a bird beak look to it. So that is just for your anterior teeth on the bottom for that mandible. Okay, next we have, and I don't really have a good example on this one. This is kind of our closest thing. This one says a maxillary root forceps where it's just very straight. And I think this one will work for uppers, so maxillary anterior teeth. So it's kind of the same idea where it has a smaller point to it on the working end. Your mandibular root forceps are the same thing. So it's just going to be that L shape. So instead of having a very, very curved type to it, it's going to come down. There's a picture on this one where it just has just that L shape to it. And that is to get the root out of there on the mandible. Okay, so that covers all of our instruments. I do want to show how you would get your suture taken care of if the dentist wants that prepared. So you're going to have an outer package. You're going to take that out, and then you're going to open up this next package, and this part could be wet. Sometimes they're soaked in alcohol. So it has a little thing right here that says fold the corner back. So you're just going to take and peel that back. And so this is where you'll see a little bit of your suture needle. So you're going to get, you can have either your hemostats, or if you have suture holders, you can do those too. We're going to clip onto our suture, and we can have it ready for the dentist, okay? And we'll go through passing that in just a minute. But just so we go over how to get that ready for the dentist. Again, if you're using this and the dentist is finished, make sure that when you're finished, instead of having it ready to go for the dentist to do the stitches, you're going to clip onto the sharp end. You're going to clip onto that pointy end. Make sure that it isn't extending past your suture holders or your hemostats. We don't want to get poked with that. And I put this far away on my tray so this doesn't get bumped, because if you accidentally bump this, it could potentially unlock, and you don't want to have that suture needle out and about to where it can poke you or anyone else. So I'm going to get this back in here so we can use that for our little suture practice. Okay, so let's get ready to do our surgical procedures. All right, so we're going to go through a few different scenarios. We have all the instruments that we were going over for our instrument pass-off, but we will just have a couple things out that you would use per scenario. So first of all, just to see how these the bite blocks work in the patient's mouth. So you're going to have this little narrow part that's going to go in their mouth first, and so you'll just have your patient open, you'll slide that in there. He doesn't open quite so well as your actual patient does, and then that's just going to give their teeth something to rest on so their mouth isn't getting tired through the procedure. Okay, so our other thing is on the instrument book how it said the mouth gag, mouth prop. So this one, when the dentist puts it in the patient's mouth, he'd have it on, put it in, and he'll squeeze this, and that clicks it, kind of cranks it open. And to release it, we can push this little lever right here, and that will release it to allow us to take it out of the mouth. So again, if your patient is spitting this one out and we need to make sure their mouth is open for whatever we're doing, we can use this one. Okay, so first we're just going to do a simple extraction. So the dentist will have his favorites, so typically you'll just have the instruments that he likes to have. So you can I'll have you grab a straight elevator, okay? So that's going to be, we have our luxator right here, we'll move that out of the way. We're going to have our straight elevator, and then we're going to have a curette. Yep, so we'll just move that right there. And then let's just do a lower anterior one, because that one's pretty simple to do, and that's easy to see. So first of all, what the dentist will do is he'll have that elevator pass to him. So I'm going to have you grab that elevator to pass to me. Now what you want to do is you always want to hold where the dentist can grab. Now the tricky thing is we don't want to touch this area because we want to keep it sterile. So you were fine where you had your hand. So I'm going to have your hand up here a little more so we can see. So hold on just before the working end so the dentist can grab onto that. And so we can maintain keeping that clean. Or if you're passing it, sometimes what I'll do, especially with kids, they get nervous. All of this stuff looks very scary. So if I'm passing it, sometimes I'll pass it right here to where my hand is blocking it so they can't see, but I'm not touching it, okay? I don't want to touch it, but I want to just block that view so they're not nervous of what's coming close to them. So the dentist will go through and loosen, and as I said before, if this is in pediatrics, he might just use a curette because that's the all-in-one instrument in pediatrics. So he'll go through and loosen, and this is after your patient's numb, okay? We're just gonna go through and assume our patient's numb on all of this. So our patient is good and numb, we're loosening this tooth. He'll pass this to you. Now one thing, let's say you had this instrument in your hand. This is a lot for a pinky. I'm gonna have you come up here so we're within camera range. This is a lot for a pinky to hold on to. So I use these 3 fingers to grab that instrument. So you're gonna grab that instrument and then you can easily pass whatever instrument it is to the dentist, okay? So you are going to have the lower anterior forceps, those little bird beak ones, and then you're going to have your surgical suction. So the dentist is going to take these forceps and he's going to get this tooth, and as he wiggles that tooth out, you're going to have your suction on, and we won't have it on just for video purposes so it's not too noisy, but you get that and you'll go right in the socket for just a second, and then you're going to go off to the side. You don't want to be in the socket for a long time because that could create a dry socket. Okay, so you would have a gauze, and you're going to have that gauze just in your hand like this, and the dentist can just place all of that in there, or he can hand the entire thing to you. It depends on your dentist, but you'll have that whole tooth and everything in that hand. You'll set that down, you'll bring me the curette so the dentist can scoop out any possible abscess if there is an abscess, or so you're going to be right kind of at the half of the tooth. You're going to be kind of fighting for space at this point. You want to be close enough that the dentist can come and kind of scrape into the surgical aspirating tip. So you want to be right up there, and he's just going to be scraping right through that socket. And then when he's finished, he'll just pass you the curette. You can set your suction down, And then you would get your gauze ready to fold it. Now, if this is just a small anterior tooth, you don't need a lot of gauze. If you're doing a molar, then I'd get a couple pieces to fold together. But with just an anterior one, I would probably take it and you're just going to, and it depends on how you've been shown, but I want to see the way that you do it first. Bring your hand up here, and I want to see the way that you, do they have you just fold it in half and then that way?
We'll use a cotton roll as well.
Okay. All right, so the way that is a great method, and there's another way that I've been told how to do it too, is we'll fold it in half and then we'll fold it in thirds or like an S or a Z shape. So I just take it and I scrunch it like this. So it kind of looks like an S or a Z, a little accordion thing, okay? And then I put that together and then I can put that right in there and have them bite, or if it's a molar, I'll put it straight down and have them bite, okay? Now, like I say, if it is a molar, I typically will do 2 pieces just because there's going to be more bleeding involved. It's a larger area, so I want to make sure that this is going to do its job. You'll want to change this out before the patient leaves. I normally put it in there. We usually do their post-op instructions, make sure everything's looking good, and then we get them ready to go. And so just at that final thing, I'll get a new gauze for them changed out. Remind them that they can still swallow with it. Especially kids, they just like, they kind of freeze when you put something like that in their mouth. So just let them know they can still swallow, and you want to encourage them to swallow, because if they just hold it in their mouth and they don't swallow, the saliva can kind of mix with the blood, and if they swallow, that's just going to make it really yucky and upset their stomach. So make sure that they're doing that, and I always send them home with a little envelope of gauze that they can change out the gauze when they need to. You don't want to change the gauze a whole bunch though. You want to try to keep it in there. If it's just kind of tinged pink on the gauze, don't have them change it. If it's soaked through, then yes, we want to change it. But we want to encourage a blood clot to form. So it's important to try to keep that gauze in place, because typically, if it's nothing severe, it takes about 10 minutes for blood to clot. So if we have good pressure with that gauze, that's going to help form a blood clot. Now, there are some other products that you could use besides just gauze. Have you ever used gel foam or something of that nature in your office, something besides just a 2x2? No? Okay. So this will be something new that you may not have heard. So we had 2 things. We had one thing that was called ActCell, not my favorite of the 2 products, and I'm sure there's tons more out there than just these, but ActCell, it really looked just like a piece of gauze that you opened like this, and you could get the size that you wanted, and you'll place it down in the socket, and it will help form a clot, and it's going to stay there. It will dissolve on its own, and it's just something to kind of fill in that space and help with any bleeding. Gel foam is the same thing, but it's thicker, okay? So gel foam, it's probably about that thick when you're looking at it. It's kind of squishy, kind of reminds me of some sort of foam, styrofoam type of material. And it will either come in long strips, the strips will be maybe that long or just a little bit longer, or they can come in sectioned squares. So the square would be about that big. The square, you can take it and kind of roll it like a little Play-Doh snake, roll it and put that in a molar, or you can cut it in half. So you'd have about that much left for an anterior tooth. Okay, and again, you'll just kind of roll it and place it in there. Those are very helpful if you are needing to fit the patient for something else, but they can't be biting on that gauze at the time. So for instance, say you needed to extract a tooth on a patient and you needed to fit them for a space maintainer, because we don't want teeth to drift into that spot that we pulled. That's a pretty common occurrence with kids. They need a tooth pulled for maybe orthodontic purposes or some other issue going on, and it's going to be a while until their permanent tooth comes in. So we will pull one tooth, and we want to get a space maintainer to keep those teeth from drifting into that spot. But they can't be biting on that gauze while the dentist is trying on bands and we're trying to cement the space maintainer on. So we'll put some gel foam in there, and that helps with any bleeding. It's not going to perfectly stop it, but it does a pretty good job. And again, that will dissolve on its own, so we don't have to worry about removing anything from the patient. Sometimes you'll need to do some gauze in addition to your gel foam, or maybe the dentist will want to put a couple stitches over top of the gel foam. That's fine too. Whatever he wants to do is, that works. Okay, so our next thing, I'm going to put this little tooth back. Now, one thing, I'm going to revert to kids a lot because there are some differences when you're working with kids. After you've extracted their tooth, what do? They do tooth fairy, okay? So we need to get this ready for the tooth fairy. So I always get a wet gauze, wipe the tooth off really well for them, get it in a little treasure chest or whatever container your office has so they can give that to the tooth fairy, okay? For adults, most people don't really care to have that tooth back, but you never know. Some people like a little souvenir, so you might just need to check on that. But we're going to pretend he didn't have that tooth taken out. We'll put that one back. And now we will do, one for the upper. Let's say that we're doing, what kind do we have up here? Yeah, let's just do that one. That one's a good one for the upper teeth. So we're going to do, let's grab one of our little east and west elevators just so we can, so the crier as it was called, or our root elevator. So I'm going to have you pass that to me. Perfect. Okay, so we're going to go through, and again, our patient would have been nice and numb for all of this. So we're going to loosen all of that. Okay, and then you are going to pass me the forceps, and you'll want to have your suction ready and a gauze ready. So the dentist will kind of do lots of rocking. The patient is going to hear kind of like Rice Krispies, a little snap, crackle, pop, possibly, as the dentist is going on rotating those around. Okay, and then he's going to work that out, and he's going to set that in. And if he's getting extra teeth, he might just go back with this, and so you just put the tooth down, come back so he can put another tooth on the gauze. Okay, so you can set that tooth down, and I'll hand you those forceps, and then I'm going to have you pass me the curette again. Okay, and so you'll get right at that socket so he can go through and get those areas cleaned out. And then you're going to take that back, then you're going to set those down, and then we'll get some gauze. So I'm going to have you fold up a piece of gauze for me. Perfect. Now, when you have your patient bite on this, as you're moving their cheek over, sometimes their lip will pull over top of their mouth, and depending on where they're numb, that area could be numb and they might bite it on accident. So make sure that lips are cleared before you have them bite down on the gauze so they don't cut their lip with their teeth right there, okay? So we want to have that out, have him bite nice and tight on there, have him do good pressure, and we'll have him hold that, okay? All right, so we'll get that tooth back in the spot. Now let's say that we're doing a multiple extraction. We're going to do a few things on this multiple extraction. We're going to take out a few teeth. we're going to use our mallet and chisel. We're going to pretend that we have some crazy roots that we're dealing with. And we're going to use our rongeurs to clip the alveolar bone. We're going to use our bone file. So we're going to have a few things. We're going to suture. We're going to use a scalpel blade. So lots of things that we're going to do on this one. Okay. So first of all, let's loosen the teeth. Okay. So we're going to grab an elevator. Just go ahead and grab this elevator again. And so we're going to go through. I'm just going to say we're going to get this section of teeth. And we're going to pretend that this first molar right here, we're going to have some crazy roots that we need to split that tooth. So you're going to pass me the mallet and chisel. Perfect. Okay. So I'm not really going to tap this because I don't want to damage the tooth. We're just going to go through the motions of it. Okay, so we're just going to tap, 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 okay, to get that tooth split. Okay, so we're first going to do, let's grab some lower forceps. Yeah, those ones right there will be great. So we're going to get this. I'm going to have you grab that gauze for me. We're going to get this first tooth out of here. Now these teeth are very slippery, so don't be shocked if I drop them. They don't stay in like your... Okay, so I'm going to release that tooth to you. You can set that little guy down. You're going to suction. Okay, so you're going to go in there. Now as the dentist has a section of teeth, you're going to be suctioning, you're going to be kind of jumping back and forth between whatever sockets so we don't have any blood overflowing in areas, okay? So he's going to work, I'm going to pull out our pretend half of the tooth, okay? So just pretend we have something in there, okay? So I'm pulling the one side out, there's our pretend half, you're going to get rid of that half, and then you're going to come back to me as I get the other half. Okay, so I'm getting that other half out. You're just going to take all, well actually, sorry, I'm not done yet, huh? You can go ahead and put that down. Okay, so get rid of that tooth, and then we have this last tooth back here. Ooh, this one's really slippery. Okay, so this, you're going to take all of it. You're just going to set that down for me. You're going to bring me the curette, okay? So as we're doing the curette, as he's working, you want to be where he is with the curette. However, you still need to keep track of the other teeth. So every so often, you'll just jump to the teeth behind, in front or behind, wherever we're at, and just do a quick little suction and come back, okay? Just a split-second suction. He can just keep going, okay? So he'll go through, work on that one, and he'll come to the next one. And then I'll do the back one, and he'll say, you know what, I think we have a root tip on this one. So let's grab our root tip picks. Now your root tip picks, this one's a double-ended, but you may have some that are just a single instrument, okay? Whatever it may be, it's just going to come to that very fine pointed end. Okay, now if he's doing root tip picks, you're going to assist him in that. You're going to have your suction, yep, perfect, she's right ahead of me. You're going to have a gauze ready to go, and you want to have your suction. That's going to help the dentist as he gets that little piece. You can help come closer with your suction and help lift that for him, because this is not a very big thing to lift up different root pieces. So this suction is very useful. So as he's going through, he's kind of getting around in there trying to feel for any root fragment, and you'll see he'll kind of slow down a little, and that's like, okay, he's got it. So then once you see it, you can get closer to it and help suction that. And once we have it, he'll kind of lift it up to you, and you're going to get that off your tip with your gauze, and then you're going to go back in if he keeps retrieving more, okay? Because you may have a few different fragments that you're going after. So he'll go for those root tips, and then he kind of slows down again, and then you'll get closer with your suction and help get that piece perfect. Okay, so now we're going to do our scalpel blade. Okay, so we have all those teeth removed. We're going to get that scalpel blade going, and I put okay, so have you done this one before? Have you loaded one like this? Oh, sorry, I didn't notice it slipped right out. Okay, so I'll have you practice this in a minute, but I'll just go ahead and load it for now, okay? You definitely would not do this over the patient's head, but just again, just for recap, we're going to just take this and slide this right in this little notch right here, and I'm kind of at a weird angle. And then we're wanting to, once we have it notched, I'm just going to move this since it's trying to slide off. And then we want to just slide this down, and then there it kind of snaps in place. Okay. So as you are going to pass this to the dentist, it would be in this packaging, like so. And you're going to pass it to the dentist. Pretend I'm the assistant right now. You're going to hold it right here, and the dentist is going to take it out. Now just be careful, because that is a blade. We need to pass it and do things slowly with this, okay? So I'm going to set that down, and I'm going to let you pick it up and get it ready for me. Good, and then just get that off. Perfect. Okay, so he will go through, do that scalpel blade, okay? And then he can pass that back to you. So we're done with the packaging. This is just to keep it sterile. So you'll take that scalpel blade, and we would want to put that in a far corner of our tray and keep it away from everything, okay? But just since we don't have a patient waiting on us, I'll just go ahead and take it off now. So we're going to take this part, hook it. Again, this would be away from your patient. Whoops, there we go. Realized I was out of the camera view. And then we're going to slide that forward off that track. Okay. Got to treat those scalpel blades with respect. Okay, so we have that. Now we're going to do our rongeurs. Okay, so those look kind of like a forceps. So you're going to pass those to me. And with these, the dentist will use this part of it, so he's going to go through and clip like that, okay? So he's going to go in and clip, clip, clip any of that alveolar bone. And as we're going through this, the dentist may need to rinse. So if that's the case, he would want a sterile water to rinse the area. You don't want to just use your regular water because it's not a sterile water, and we don't want to introduce any type of infection to our patient. So if you're doing that, you're just going to sit there and suction for him, and he might have it in a syringe or something like that to irrigate the area, okay? So once we've done that, we're going to do our bone file. Going to make sure everything's nice and smooth. Okay, so we're going to get that bone file going. And then again, he might have you rinse again, so we do our sterile rinse, and then we're ready to suture things up. Okay, so we're going to get our suture needle is right here, and our suture holder. And you're just going to get that end clipped. Make sure when you clip the little suture holders that it locks in there. And this kind of depends on the dentist. I'm going to snag this from you for just a second. So the dentist may just have you keep it in the package and he'll just pull it out. Or he may have you take this out. Some of them like you to get this part wiped off if it was soaked in alcohol. If he has it out of the package, you want to hold on to the end so it doesn't touch everything. We want to keep it clean. So I'm going to hand you the end. And as you're passing it to the dentist, you'd hold on to it somewhere around here. Okay, so I'm actually going to have you pass it to me. So just hold right through there. And you want to pass it to where the dentist can get his hands right through the suture, okay, the suture holder. And he may take it and adjust it if he needs to get a little better angle, okay. So he's going to go through, get that suture needle through, pretend this is stitching through it, okay. So we're going to go through there, and I'm going to hold this down just so we can pretend that it's in there. And so he's going to slide that through, and you're just going to follow with that string until it gets to there. And then you can just let it go, okay? And then he'll go through and he'll kind of swirl his suture holder to make knots, okay? He's going to do little knots for each stitch. You really don't have anything that you need to do at that moment, so I normally was wiping off my instruments, any blood that's on them, any teeth that we'd extracted, and I would just keep an eye for when he would go like this, and I would see 2 strings pulled tight. That's my cue to come in and cut the suture thread, okay? So I'm going to, why don't you grab the suture scissors, and I'm just going to cut some of this off. Let's just cut right there. And these scissors, we need to get some new ones. Those ones aren't very good. Okay, so just keep those suture scissors. I'm just going to move that out of the way. And I'm going to make a little knot here just so we can have a little example of our knot that you would be cutting for the dentist. I'm going to do just a little more so I have something to hold on to. So let's just pretend this was sitting in the patient's mouth just above the socket area where he's, okay, that's not really right where I want it, but that's okay. All right, so this is sitting in the patient's mouth. I'm going to clip it right where that knot is. Okay, sitting in their mouth, and we have the knot. That's not really working. Okay, so he's going to pull it tight where you have those 2 pieces, and you are going to go just a tiny bit above the knot. I'd say if we're using the length of this, I'd leave about that much length. So from here to here, maybe just a little bit of. So I'm going to have you clip both of those. They'd actually be right together. It's kind of hard to mimic this when you don't. Okay, there we go. And these scissors are awful. Sorry, I didn't realize they were so bad. Okay. They'll cut a lot better than what that just did. But we want to have just a little bit of a tail from the knot. It's kind of a fine line, because if we have too much of a little tail, your patient is going to go nuts with it. It's just going to bother them, and they're going to play with it with their tongue. So we don't want that, but we don't want it too short to where it's going to, the knot will come undone. So it's a fine line on that, and you could even just put it in place, the scissors, and the dentist can tell you whether he wants you to go higher or lower. And sometimes you're in there with the scissors, and just the way that you're sitting with your chair, it's hard to see where you're at anyways. And so sometimes as I'm going in there with the scissors, I'll just kind of sit there and wait for him to tell me higher or lower, because I honestly can't tell where I'm at. And then he can say, all right, right there, and then I can cut, okay? So don't be shy to have your dentist help you out on seeing that. And then when we're finished, we want to make sure, whether the dentist does it or whether you do it, always make sure to take that end, that suture needle end, and clip it so we don't get poked, okay? When we're finished, when we're cleaning up our tray, we can actually clip the rest of this thread off. This can just go in the biohazard, and this needle part will go in our sharps container, and our scalpel blade will go in our sharps container as well. Now when you're passing this like if you're passing it or the dentist is handing it off to you, be careful not to bump this. We don't want it to spring open and drop this suture needle, okay? All right, so we're all done with our stitches. He would have gone through and stitched up each of those areas. You would have just watched for those 2 little strings to come up and clip each of those. I'm going to have you hand me the teeth, and I'm going to put those back in his mouth. From finishing this appointment, you would have made note of how many stitches they had placed, so when they come in to have the removal of their stitches, that we account for every one of those stitches. We certainly don't want to leave anything behind. So as we're removing the stitches, you can just, sorry, it's kind of hard to get my fingers all the way back there. You can just get some forceps, kind of lift the knot away, and you can clip the knot and just pull it out. Make sure to lay it on a gauze so you can account for each of the suture knots that were made. If the patient bleeds, that's possible because we're kind of messing around with that area. We can just do a gauze again. So when our patient is finished, we want to make sure that they have that gauze or gel foam, whatever it is that we're putting in there to keep the mouth from any bleeding. We want to make sure that they take it easy. If, depending on what it is, if it's just a tiny simple extraction, just have them take it easy for that day. But if we're doing wisdom teeth, you're down for a little bit. You need to make sure that everything heals properly. We want to make sure to do a kind of like a lukewarm saltwater rinse. That will help keep the area clean. We need to be careful when we're brushing so we don't, if we had stitches and things like that, we don't want to hurt the area. We want to stay away from like chips and nuts, things that are kind of sharper. So we're going to go more on a softer food diet while the patient has had those extractions done. We don't want to be doing lots of hard physical activity. If you have a patient that they're like, hey, I've got a soccer game, you're going to have to not go to that soccer game because all that running and jostling around isn't good for that area that we just did the extraction for. But it can vary, so they'd need to talk with the dentist and get his opinion and his approval on what is okay and at what point they're okay to do it at. So I just wanted to go over this just to make sure that we don't miss anything on all of our post-op instructions, because it kind of depends on the severity of what we just did for our patient. So this, don't rinse or spit for 24 hours after surgery, just because we don't want to disrupt the area, okay? Keep fingers and tongue away from the socket or the surgical site. Use ice packs on the surgical side, the side of the face for the first 48 hours. Putting ice 20 minutes on, 10 minutes off, or sometimes they'll say 20 minutes on, 20 minutes off. It kind of varies on that one. But we just want to keep something to help with swelling, okay? Let's see, for mild, frozen bags of peas work well if they don't have an ice pack. And I will mention one thing. There's ice packs that you can use to put in your lunchbox, and then there's like medical type of ice packs that they'll have little beads in them, and so they're soft and pliable, so you can have that form to the face and you don't feel like you have this big old block on your face. So if they want something that's a little more softer feeling, then they can go in the medical section of like where you get your Band-Aids and stuff like that, and they typically have those there. Let's see, so we have taking Tylenol or ibuprofen, and you can switch between those. They can take Tylenol, and then after the amount of time for Tylenol, then we can rotate to doing ibuprofen, because ibuprofen is going to help with more inflammation on things. So every 3 to 4 hours. And then severe pain, it would be something prescribed. Now that's something that is important to go over and know. If you have a patient that had an in-office sedation, they will have a sedative given to them, not a sedative, sorry, a pain med, pain med given to them in their IV. Okay, so that's taken care of. That's an important thing to know, because I've had a mom who came and she's like, we literally finished with the surgical center. And I had left the surgical center, got back to the office, and just was taking care of some things in the front office because we don't have patients on that day. And she said, my kid needs pain meds. And I said, for anything that was with what our office does, it's not to the degree where we need to prescribe Percocet and all the big, tougher milligram doses of pain meds. And so for her, I said, oh, you can just do some Tylenol or ibuprofen. Off brands are fine too. That's totally fine. If there's just a store brand, that works just as well. So don't have them feel like they need to do that. It's just, most people know it by Tylenol instead of saying acetaminophen, you know. So let them know that that's just fine. But for her, she really felt like he needed something. And she said his mouth hurts. A lot of times their mouth will hurt for a few reasons. It's still numb in the area, but they don't know what that numbness, they don't understand what it is. And so a lot of times the only word that kids can come up with for numb is calling it hurt. Okay, so that's one thing. Let them know they're numb, it's going to feel funny, and so they could misinterpret that as something hurting. Okay. Now, when we're doing the extraction, there's a lot of pressure. So that's another important thing to make sure that your patient understands is we've numbed the area. It shouldn't have any like finger pinchy pain to it, but they're going to feel pressure, okay? We can't take pressure away with our anesthetic. So that's one thing that they'll still have discomfort with for an extraction is that pressure. But going back to that one mom, so it was important for me to let her know he already has a pain med in his system, so you don't really want to give him anything right then anyways. So when she gets home, after the amount of time the pain med wears off, then we can do that Tylenol and ibuprofen, switching off between those. Okay, if the muscles, oh wait, no, sorry, skipped one. So drink plenty of fluids, do not use a straw. Straws, smoking, anything that has a suction action to it can cause a dry socket, okay? And that's going to cause some pain for your patient. That a dry socket is where the blood clot dislodges, okay? If the muscles of the jaw become stiff, chewing gum at intervals will help relax the muscles using a warm, moist heat on the outside of the face over the muscles. You can kind of do little massages too at the temporal area, that joint. The gum thing, that would just be obviously anywhere that wasn't where the surgical site was. Try to keep that gum away from those areas. Let's see, after the first post-op day, using a warm salt water rinse following meals for the first week to flush out particles of food and debris which may lodge in the surgical area. And your salt water rinse is just a half teaspoon of salt in a glass of warm water. And you want to be careful that you're not swishing hard. You want to just do a gentle swish so we're not disrupting anything. Diet may consist of soft foods, which can be easily chewed and swallowed. Like I said, nothing pokey, so it's saying seeds, nuts, rice, popcorn. A certain amount of bleeding is to be expected following surgery. Bleeding is controlled by applying pressure to the surgical area using a gauze for 90 minutes following surgery. If bleeding continues, replace gauze with additional gauze and continue pressure. If there, for any reason, is bleeding that can't be controlled, then you want to, depending on the severity, for most, if it's like a medical thing, we obviously want to call 911. If we feel like it's something that, you just want to check with the dentist, then see if you can call him. Most dentists will have an emergency line, but we want to make sure that we get that bleeding taken care of. After that time, remove the gauze and eat and drink as instructed. If bleeding persists, you can use a moist tea bag that can be placed in the area of the bleeding and bite firmly for 1 hour straight, and that will aid in clotting, and repeat if necessary. Do not smoke for at least 48 hours following surgery, preferably for 5 days. Nicotine may break down the blood clot and cause a dry socket. Relieving pain, we want to immediately take the prescribed medication, or if you don't have anything prescribed, then just like I said, the Tylenol or ibuprofen. And they'll be numb depending on the anesthetic for a couple hours. Then minimizing swelling would be that ice, the 20 minutes off, 10 minutes, 20 minutes on, 10 minutes off. Make sure that we have something blocking the skin, and those little medical ice packs that I was telling you about, they actually have like a little felt side, so that can just go right on there, so that's nice. If you don't have something like that, then you want to have like a towel or something so it doesn't damage the skin with that cold temperature. Okay, I think that pretty well covers it.